نعم دكتور، شكرا جزيلا وعاشتكم طلاب. بس حابة أتأكد إذا الصوت واضح قبل ما نبلش.
ممتاز.
تمام، شكرا جزيلا. أول شيء حابة أرحب بنفسي. مساء الخير، اسمي سارة اياد، طالبة الصيدلة مرحلة 5 بجامعة البصرة على أبواب تخرج إن شاء الله. وصراحة أنا جدا سعيدة اليوم إنه راح أقدم لكم هذا البرزنتيشن، وجدا سعيدة بحضوركم وجدا سعيدة بهالمبادرة بشكل عام. المحاضرة راح تكون باللغة الإنجليزية، وبنهاية المحاضرة أنا مستعدة أجاوب أي سؤال أو استفسار خاص بالبرزنتيشن أو خاص بالمحتوى مالته. And yeah, let's start. So today our presentation is about anabolic steroid abuse. Now, before heading to the lecture, we're going to talk about the objective of the seminar today. First, I'm going to give you a brief introduction about the headline, which is anabolic steroid abuse. Then we're going to discuss the different types of steroids and mention anabolic steroid uses and forms. And finally, we're going to highlight anabolic steroid complications and understand the psychological urge to use anabolic steroids. Now, I chose this topic because it's a rising issue in our community. More and more young people in our society are now heading to use anabolic steroids, especially in the gym. And it has major complications, major life-threatening effects on their lives. And we're going to discuss this right now. So I'm going to begin the seminar today by asking you a few questions that you don't have to answer right away. You can reflect and you can think about in your mind. First of all, when I say the word or the phrase healthy on the outside, unhealthy on the inside, what is the first thing that comes up into your mind? And when I show you this image, an image of a completely healthy man with muscles, and you can see that this man is very fit. However, you can see the inside of the body is filled with drugs, filled with medications. What is the first thing that comes into your mind when seeing that image? Now keep that question in your mind and try to find an answer for it. Okay. Are you familiar with the term anti-doping? Now, if you're a football fan, if you love FIFA, if you love sports, then you may have heard of that term anti-doping, because many athletes and many people who practice sports are familiar with the term anti-doping. And now we can link that both the healthy on the outside, unhealthy on the inside term and anti-doping are related to our subject today, which is anabolic steroids. Now we have to understand that we have two types of steroids. We have non-anabolic steroids, and the term anabolic means constructive or building. So you're building up something. And we have non-anabolic steroids that we are going to discuss later. So for non-anabolic steroids, they are synthetic products. They are human-made, and they are structurally similar to something we have in the body called glucocorticosteroids. Now, glucocorticosteroids are basically synthesized and stored in the brain in this area called the hypothalamus, and then released and stored here, and then released from the interior pituitary gland. We have this posterior pituitary gland and interior pituitary gland, and the product is released from the interior pituitary gland. Okay. When to prescribe glucocorticosteroids or non-anabolic steroids such as corticosteroids, we prescribe them for patients suffering from inflammation. As you can see here, this patient is suffering from inflammation and swelling, so we would prescribe non-anabolic steroids such as corticosteroids. Now we're going to talk about the anabolic steroids. Now you may think that anabolic steroids are completely harmful and we should not use them. However, we use them in medicine, we use them in pharmacies as well. So first of all, we have to understand that anabolic steroids resembles the endogenous testosterone that is released in our bodies. Now, I know that you may think that testosterone is only released in males. However, testosterone is found in both males and females, but of course in higher levels in males. Okay, now when to prescribe anabolic steroids? Now we mentioned that they're similar to testosterone, so they have the effect of testosterone that gives the physical strength and give the more male characteristic to the patient. First of all, we prescribe them for men who are suffering from anemia, which is low levels of red blood cells. We also prescribe them for men who cannot produce enough endogenous testosterone, and this happens in situations where there is surgical removal or certain medical condition that would stop the patient from getting enough testosterone, such as cancer. And we prescribe them for patients, young patients who are suffering from delayed puberty, in children and young teenagers who are not growing properly. We prescribe testosterone to induce the growth process. And finally, we also prescribe anabolic steroids that resemble testosterone in cases of muscle mass loss. This happens in patients who are suffering from HIV. There's a medical condition called cachexia where there happens of muscle loss, and we treat that with anabolic steroids. Now, this is the good side of anabolic steroids. The harmful side of anabolic steroids, which is the non-pharmacological use. Now that we discussed that at the beginning, you may be more familiar with the uses of anabolic steroids. So they're used by athletes to first increase the muscle mass that we discussed earlier and improve the physical performance, because it gives the person the strength and the muscle mass required to do certain exercise or certain sports. And also, anabolic steroid use here is illegal and known as anti-doping. That's why many sports organizers and many sports staff disallow this, and it's forbidding there. That's why it's called anti-doping, and there are anti-doping programs to prevent the use of anabolic steroids. Now, it's also used by regular people in the gym, unfortunately, for the same reasons, to increase muscle mass and to achieve the typical muscular male appearance, which is full of muscles and the fit kind of physical appearance. Okay, now why anabolic steroids are commonly used? Because of their forms. They are found in multiple forms, easily taken, such as tablets or pills, such as capsules, and hypodermic needles for direct muscle injection. Now, the easiest way and the fastest way to achieve the desired result is with, of course, the needles or the injection. However, it is the most risky way to achieve the effect, and it has several complications. Okay, now we're going to talk about complications. I'm going to start talking about complications that show on the physical appearance and that other people can notice, such as acne, as you can see in the picture, and aggressive behavior. The patient or the person tends to become more aggressive because as the levels of testosterone and anabolic steroids increase in the body, the tendency to become more aggressive and more angry in general increase. And for teenagers using anabolic steroids without medical supervision, they will lead to the stunted growth, which is the stop of growth or delayed growth in teenagers. Now we're going to head for the more serious side effects or complications, which are high blood pressure, high cholesterol, heart problems, including heart attack and liver disease, cancer, and kidney damage. And in men especially, they would suffer from baldness, breast growth, infertility, and shrinkage.
سارة الآن العرض راح سارة البرزنتيشن ما موجود.
نعم دكتور، هسه أحاول حل المشكلة.
تمام. العرض كان
مستقر جدا على الإسماعيل. أوكي. آخر شيء وصلنا أعتقد الcomplications.
نعم.
Okay, so regarding the complication, we first discussed that the most common and physically apparent complications are acne, aggressive behaviors, and stunted growth in teenagers. We also have more serious side effects such as high blood pressure, high cholesterol, heart problem including heart attack, liver disease, and cancer, and finally kidney damage. We also have in men baldness, breast growth, infertility, and testicle shrinkage, and in women in sport who use anabolic steroids, they would suffer from changes in the menstrual cycle, which is period. They will face a lot of increase in the facial and body growth of the hair, and male pattern baldness, and finally voice deepening. Now, after discussing everything, we want to know why people are still using anabolic steroids. Even though we discussed the complications, even though we're aware that anabolic steroids have long and short-term side effects that could be harmful and life-threatening. Why people are still using that? Because over the last several decades, unfortunately, the image of the idealized male body in much of the Western world has shifted toward higher level of muscularity. So today's young generations and young people are constantly exposed to muscular male images in the TV, magazines, in the ads, in movies. This encourages young people and young teenagers to follow that image and to try to mimic those superheroes, those celebrities, those TV stars. And unfortunately, this is a rising issue not only in the Western world, but also in our communities as well. What can we do in these situations? As people who attended the seminar today, as educated people, we can also push people to think more about the side effects and the long-term complications of anabolic steroids. We can raise awareness. We can encourage people to do the regular exercise instead of using anabolic steroids. And that would be it. Thank you so much for listening, and keep calm and stay away from anabolic steroids. Thank you.
شكرا سارة، عشتي العرض جدا ممتاز وجدا جميل. الأكسنت رائع باللغة الإنجليزية. شوف إذا أكو أي سؤال من قبل الحضور سواء بالشات أو طلب الكلام.
شكرا جزيلا دكتور، كلش أقدر هذا الشيء وأعتذر على الخطأ التقني اللي صار.
هذا مو بيديك، هذا التقنية مو بيدنا.
تسلم دكتور.
نحاسبك علميا، ما نحاسبك تقنيا.
تسلم دكتور، أنا أتفق.
تفضلي دكتورة سبا.
السلام عليكم.
عليكم السلام ورحمة الله.
شكرا. طلابنا طبعا يوم اسبوع على اسبوع الطلاب جاي يفاجئونا يعني صراحه بامكاناتهم
ورود
والله العظيم يعني وجمال الالقاء مالتهم. طبعا سارة من طلابنا بكليه الصيدله، والموضوع اللي طرحته يعني هو انترستنج، يعني فيري انترستنج الانابوليك ستيرويد. بس اكو فد مشكله انه لا زالت الانابوليك ستيرويد تنباع بالصيدليات ونشوفها التاثر هذا بالسوبر هيرو موجود ساره، يعني عند كل الشباب الموجودين خاصه هذول اليونج اللي يبدون دائما يصير عندهم ماسلز ويصير عندهم فتنس. بس هي المشكله انه الصيدليات هي المشكله اللي جاي تبيع هاي الشغلات بهيك كميات يعني، وجاي يستخدمونها يعني بدون اي رادع. يعني انت ما جاي تشوفين انه هاي المشكله هي يمكن تقع على عاتقنا احنا همين، انه احنا نكون احنا همين السبب. انتم هسه كطلاب ان شاء الله راح تصيرون صيادله وموجودين بالصيدليات، صارت شغله تجاريه يعني هسه جاي يبيعوها يعني بشكل. شنو الرادع اللي موجود اصلا المفروض من النقابه انه ما تبيع هالشكل ادويه بدون اي يعني وصفه طبيه او بدون اي يعني رادع من قبل نفسها الصيدليات. طبعا هذا ما جاي احكي بس على الانابوليك ستيرويد، يعني فشيء
صورة عامة هي اثكس. دكتوره هي اثكس يعني اخلاق المهنه
بالضبط. يعني دكتور صدق يعني احنا عندنا مجموعه ادويه هي اوفر كاونتر، يعني ممكن انه تنطي، بس صارت كل الادويه اوفر كاونتر هسه حاليا بالعراق يعني.
نعم.
جاي تعطى بشكل يعني يا ريت يعني شويه تركيز على هاي المشكله. يعني احنا ممكن احنا نريد نحل هاي المشكله. هاي المشكله هي الاهميه يعني بالنسبه لها للانابوليك ستيرويد. زين ساره، يعني سؤال والله لك، انت جاي تشوفين يعني انت عجبتيني انه ممكن انه حتى الومن ياخذوها الانابوليك ستيرويد، يعني عادي عندك هيك شكل احصائيات؟
نعم دكتورة، طبعا شكرا جزيلا تواجدك اليوم ويانا. أنا صراحة أتفق وياك، إحنا كصيادلة الواجب علينا إحنا يقع إنه نحاول نحل هاي المشكلة. مثل ما هسه الأدوية النفسية صارت كنترولد وصار ممنوع إنه الأدوية النفسية تنصرف بدون وصفة طبية.
هي فقط هسه الأدوية النفسية بس، تعرفين أنت وأنا يعني وياكم متوصى بالعقاقير، صارت الشغلات اللي فيها يعني هاي السيرابات اللي تحتوي على نوع من انواع ليدوكين وغيرها صايره هم بعدها تنباع، هسه شويه صار ريستركشن عليها يعني.
صحيح.
اقل، قبل كانت تنباع يعني عادي ويستخدمونها كبدائل للتخدير يعني. بس هسه يعني هي هاي تقع على عاتق صراحه يعني بالصيدليات بصوره عامه، يعني لازم يعني بدون ترى حاجه من
اعتقد دكتوره سبأ يفترض يكون اكو فد درس مقرر بكليات الصيدله هو الاخلاقيات المهنه.
نعم دكتور، احنا عندنا هذا،
فلازم الالتزام به، يعني هو المشكله اذا الالتزام به.
دكتور هو هم اكو التزام ثاني لازم يعني يجوز هم ما نقدر نحمل، يعني اكو كثير من الصيادله في صيدليات ومو صيادله يعني يوقفون.
هاي مشكله ثانيه، هذه
مشكله ثانيه يعني، فيجوز هذا هم ما عنده خبره بالادكس اللي موجود. بس اذا نرجع للسؤال يعني ساره، موجود انه يعني فاجئ انه الومن جاي ياخذون الانابوليك ستيرويد عادي هسه، يعني عندك هالشكل احصائيات؟
نعم دكتورة، أنا مبدئيا بحث التخرج الخاص بي هو خاص بالأنابوليك ستيرويدز، فقرأت هواي إحصائيات بالنسبة للأثليت سيستم الموجود عندهم. مو فقط المن يستعملونه، الومن اللي يشاركون بالمسابقات مثلا ركض المسافات طويلة يحتاجون يبنون
يعني احكي على مستوى الرياضيات صحيح، بس قلت يعني هسه احنا عندنا بالعراق مثلا صايره هالشكل حالات يعني؟
لا دكتورة، احنا سلمنا سيرفيز او استمارات ناخذ بيها يعني استطلاع بالنسبة للاشخاص اللي يستعملون ستيرويد، وسلمناها الجيمز موجودة عندنا بالبصرة، واللي اجتنا الاجوبة والاشخاص اللي يستعملوهم حاليا فقط الشباب، ماكو شابات او بنات
انا هاي اللي اسال عليها. انتم اكيد رايحه مسويه
نعم
كويشنير حتى داخل الجيم، يعني الجيم النساء ما عندهم هالشكل شيء، فقط على
نعم دكتور.
وهنا هم دكتوره